Good day, everyone. Today, we were going to discuss medication administration, skin integrity, and wound care. So, before we begin, let me introduce myself. I'm Cecil Bernaldez. My group members are Kea Biadnes, Rolf Cabras, Cristel Cordero, and Michaela Dafilmoto. So, medication is something that you take when you are sick or you have a problem with your body. It can help diagnose what is wrong, cure illness, treat the symptoms, or even prevent diseases from happening in the first place. So basically, when we say medication, it's like a tool that doctor use us to make us feel better and stay healthy. In the healthcare field, people often use the words medication and drug to mean the same thing. However, when someone says drug, it can also refer to illegal substances like heroin or cocaine. While medication naman have been around for a very long time even in ancient times. People used natural remedies to treat illnesses. So over time, there had been a lot of more drugs created and available for us people. As these drugs were developed, we also learned a lot more about how they work, what the effects on our body. So we know much more about each drug than we used to do before. Prescription, it is a written direction for the preparation and administration of a drug. So, commonly, prescription naman, ito yung written order ng doctor para sa pag-prepare at pag-administer ng drug sa pasyente. Nagtataka ba kayo minsan bakit some medications have different names? Well, there are actually four kinds of names that drug can have. So one drug can have four kinds of names. So first one is the generic name, second, trade name or brand name, third, official name, and lastly is the chemical name. The first one is the generic name, which is given by the group called United States Adaptive Names Council. And ginagamit ito for the entire lifetime of a drug that used to identify drugs. So yung mga pangalan na drugs nasa belong sa group ng United States Adapted Names Council is ginagamit para ma-identify yung drug. Then, there is the trade name or the brand name which is chosen by the company that makes and sells the drug. These names help identify its property of that specific company and usually short and easy to remember. So, sa brand name or sa trade name naman, yung kumpanya talaga is na gumagawa ng drugs ay nag sila naman yung um, nagpapangalan ng drug na yon. Usually, yung pinipili nilang name is short and easy lang na maalala ng mga consumer sa market. But when a drug is still under patent protection, meaning no other companies are allowed to make their own version, yet it can only be sold using its trade name. However, when the patent expires, other companies can start making their own versions using the same generic name, but creating their own unique trade name. The third kind of name is called the official name. This is simply how drug appears in official publications like medical journals or pharmacopoeia, drug handbook that contains information about drugs. Lastly, there is also a chemical name which describes exactly what compound make up each medication. This one might not be very important for most people since chemists use it more often than the doctors or the patient. Finally, um, this one is a very precise information about what exactly constitute each medicine. Example is paracetamol. The generic name is paracetamol. Trade or brand name is biogesic, tempra or bioflu. Official name is paracetamol. Chemical name is N-hydrophenylene acetamide. So there are different types of drugs preparation. The first one is the aerosol spray or foam. One of the example is the flinoxase, ginagamit para pag-spray sa nostril for allergic reaction or allergic rhinitis. Aqueous solution naman, ang example niyan is Ventolin, ginagamit through nebulizer or inhaler for asthma or COPD. Aqueous suspension naman is amoxil or amoxicillin suspension. Ginagamit siya through oral suspension, usually taken for bacterial infection. Caplet naman is paracetamol caplet or the biogesic, swallowed ng buo with water for pain or fever. Capsule naman, example niya is Lusec, swallowed din siya ng buo for stomach ulcer and acid reflux. So, ang pinagkaiba ni caplet and capsule is, si capsule, meron siyang thin layer ng parang plastic or na madidissolve siya pag ininom mo na siya or once mo na intake mo na siya sa katawan mo. Unlike si caplet is, wala siyang thin layer na nag-cover sa kanya. Kumbaga, pag once na purong purong drug siya once na ma-intake mo siya. Unlike kay capsule, meron siyang thin layer at doon sa loob ng thin layer na yon is merong powder or parang powder na color white. Next is the cream. Example ng cream is Dactarin. Ginagamit siya for fungal infection. Elixir naman is Nutrilin ang example niya, taken orally as dietary supplement. For extract, Lagondy leaf extract for cough relief, usually taken orally for cough and respiratory conditions. Gel or jelly naman, ang example niyan is Dalacin, applied siya for acne or skin infection. Liniment naman, ang example niya is omega painkiller, ginagamit for muscle or joint pain. Then, lotion, an example ng lotion is the Caladryl, applied siya for itching or skin irritation. Lozenge naman ay ginagamit for sore throat. Dissolve siya sa mouth for sore throat relief. Ointment naman, ang example ng ointment is si Celostoderm, applied naman siya for inflammation of skin or skin condition. Ang paste naman is, example niyan is zinc oxide paste for diaper rash. Applied siya to protect skin from irritation. Pill naman, an example ng pill is aspirin pills for pain relief, swallowed whole with water for pain or fever relief. Then, the next one is the powder. An example niyan is Hydrate, minix siya with water and consume for hydration. Suppository naman is yung paracetamol suppositories or tusiran, insert naman siya sa rectum for fever or pain relief. Then, sa powder naman, meron tayong example, oral rehydration salt or Hydrate, minimix siya with water and consume for hydration. Suppository naman or tusiran, ini-insert naman siya sa rectum for fever or pain relief. Syrup naman, meron tayong Ambroxol syrup taken orally for cough and respiratory condition. Sa tablet, meron tayong example is metformin tablets, swallowed whole with water for diabetes management. Tincture naman, meron tayong iodine tincture for wound disinfection. Ina-apply siya to clean and disinfect wounds. Transdermal patch naman is nicotine patch or Nicorette, applied for the skin, smoking cessation, delivering nicotine gradually. Then the next one is drug standard. So drug can come from natural resources like plants, minerals, and animals, or can be made in laboratory. They have different levels of strength and activity effects in body. To make sure that they work consistent and predictably, drugs need to be pure and uniform strength. Drug standards have been created to ensure that the drugs are made quality. In United States, official drugs are listed in U.S. Pharmacopeia or UCP and describe their sources, property, purity tests, storage methods, dosage amounts, and categories. Some people prefer to buy natural vitamins or supplements from health stores or pharmacy. without prescription kasi kampante yung mga tao or yung consumer na yung product na yun is good since it is natural. These products may have not always be regulated strictly because um, pwede siya, pwede mo siya mabili without prescription. But it can cause problems with the consistency in strength between batches. For example, if may thyroid supplements na nanggaling sa natural sources, at pwede to siya mag-vary sa strength or sa dosage ng kinakailangan ng isang pasyente or isang tao. For the meanwhile, mahirapan ang yung doctor to manage those symptoms consistently for the patient na nangailangan nito. That's why synthetic thyroid medication is more predictable when it comes to its strength. So doctors usually predict this form instead of natural alternative if possible. Kasi usually yung mga natural sources is wala siyang hindi mo siya malalaman yung strength ng or kapasidad ng dosage niya. At hindi siya mapipredict ng doctor. Meanwhile, sa synthetic naman or yung ginagawang medication through laboratory is mapipredict or consistent yung effect niya sa katawan ng pasyente. Pharmacopoeia is a book that lists products used in medicine along with the description of the products, chemical tests to determine their identity and purity, formulas, and prescription. In U.S. National Formulary, there is a type of book which listed drugs and their therapeutic value. Nurses use pharmacopoeias that are very helpful reference because when nurses administer many medication, they are responsible for assessing their effectiveness while also recognizing any unfavorable reaction to drugs. So, medication and drugs handbook can be useful reference for nurses because it is impossible to remember all pertinent information about large number of drugs. So therefore, having reliable reference na available will help the nurses to provide better care for the patient. So, for the legal aspect of drug, so nurses need to know how the Nurse Practice Act in their state defines and limits their functions. Second is recognize the limits of their own knowledge and skills. In United States, there is a law that regulates the development and administration of drugs. Nurse must be aware the State Nursing Practice Act, which define and limits their own function, and they should know the limits of their own knowledge and skill. It is important for nurses to work within this limit as going beyond can put client lives at risk and lead to negligence of law. If the primary care providers was incorrect order for medication, it is still yung nurse pa rin is responsible to administer the correct dosage. Therefore, the nurse should ask question any orders that seem unclear, including the use control of substance. Those substance must be kept in secure location, locked drawers, or medication charge. Laws require careful monitoring of drug name or dosage, signatures of those who involved in preparing and giving medication. So, before administering controlled substance, nurse must verify the availability against inventory records before proceeding the administration. So, if merong unclear between the available amount sa record amount, then corrective action must be taken before proceeding with administration. This means that healthcare workers or they need to dispose of them properly while also making ensure someone else witness it happening. When they take the stock of how much medication they have left at the end of their shift and compare it with what was left over from the previous shift after the accounting for any usage before their during or their own shift. If something doesn't add correctly, they report it right away so that everyone can figure out why there is an issue and fix it necessary. Then, the legal aspect of drug, U.S. Drug Legislation, Food, Drug, and Cosmetic Act 1938 implement by the U.S. Food and Drug Administration (FDA) requires that the label must be accurate and that all drugs be tested for harmful effects. Then, Durkheim-Humphrey Amendment 1952 clearly differentiate that can be sold with a prescription and those can be sold without prescription and those should not be refilled without new prescription. So, this law naman, din-differentiate niya yung drugs na pwedeng mabenta na may prescription, yung drugs naman na pwedeng mabenta without prescription or yung mga over-the-counter medicine, and yung drugs naman na hindi ka pwede makabili pag walang bagong prescription na ipapakita mo. Then, the next one is the Kefauver-Habeas Amendment 1962 require proof of safety and efficacy of drug for approval. So, sa proof of safety and efficacy, usually ang ginagamit dyan is yung prescription by the physician. Then, the Comprehensive Drug Abuse Prevention and Control Act 1970 or Controlled Substance Act. Ito naman is kinakategorize yung controlled substance at ang limit nila kung gaano dapat ginagamit sa pag-prescribe and established by the government-funded programs to prevent and treat drug dependence. Then the next one, the effect of drugs. When you take a drug, there are different effects that can happen. The primary effect is the one that is intended and it's called the therapeutic effect. For example, if you take morphine sulfate, that therapeutic effect is to relieve pain. If you take diazepam naman, the therapeutic effect niya is to reduce anxiety. However, sometimes drugs have unintended effects which are called side effects. This can be harmless or potentially harmful, and they usually predictable naman. Some side effects are okay, but they don't interfere with the main reason for taking the drug. But the other side may become more serious and more required to stop or change the medication. Yan naman yung tinatawag nating adverse side effect or yung mas lala sa side effect. Adverse effect. Dito naman, the nurse should watch out for this kind of side effects and report to the doctor so they can decide what to do. Then the next one, drug toxicity. Sometimes drugs can be toxic in our body, which means that they start causing harm instead of helping us to feel better. This happens when we take too much of drug or if our body isn't able to get rid of it properly over time. Or ito naman yung di kaya ng kapasidad ng ating katawan, tinatawag siyang cumulative effect. Toxicity from drugs Toxicity from drugs can show up immediately or after weeks or months. Drug allergy. Drug allergy naman is when our body has an immune reaction to a medication. When you are exposed to something foreign like a new medicine, your body may produce antibodies that cause allergic reactions. This means that you can have symptoms of an allergy just like if you are allergic to something else. Allergic reaction can be mild or severe and happen anytime from a few minutes to 2 weeks after taking the drug. Mild reaction might include like rashes or diarrhea, while severe reaction naman is called anaphylactic, usually happen right away and can be dangerous if not treated quickly. The earliest symptoms should always be taken seriously by treatment given. Then, the next one is drug tolerance. Drug tolerance naman is When someone is need niya ng drugs to get rid the same effect as before. This happened with drugs like opioids, barbiturates, and alcohol. So if someone takes too much of a drug or it takes too often, palagi siya nag-i-intake ng drugs, they might have cumulative effect where the drug builds up in their body and causes toxic symptoms. An idiosyncratic effect is unexpected or individual to each person. Some people may not respond enough to a drug while others may respond too much. So, pwedeng maging effective yung drug sa kanya or pwede yung drug effective sa kanya naman is hindi. Sometimes drug can even have completely different effects or cause unpredictable symptoms for a certain people. Kasi yung kanya-kanya tayo ng kapasidad ng katawan sa pag-intake ng drugs. So, pwede maging effective sa kanya, sa akin hindi. So, for drug interaction naman, nakatry na po ba kayo na intake ng sobra pa sa isang drug at the same time? Halimbawa, nag-inom ka ng biogesic at the same time nag-inom ka na ng vitamin C. So, if so, you have been experienced a drug interaction. This happens when one medication affects the way another medication works in our body. Drug interaction can be good or bad. Sometimes they make the medication work better together, or what we call the potentiating effect, and other times they may work less effectively, or the inhibiting effect. Potentiating or potentiating effects can either additive or synergist. Additive means that two drugs at the same time increases each other effectiveness, while synergist means that two different drugs work together to increase their effectiveness. So sa additive, same type ng drugs. Sa synergist naman is different type ng drugs, pero they both work together for the increase of effectiveness. Sometimes doctors prescribe multiple painkillers like aspirins and codeine together because when they combine, they provide greater pain relief due to an additive effect. So, it is important to take note that a certain food can interact negatively with medications too. Unfortunately, taking medication does come with some risks, like iatrogenic disease. Ito naman is disease caused by unintentional by medical therapy such as drug therapy. An example nito is liver damage, nag-result dahil sa bile duct obstruction or renal damage because of malformation of fetus if a certain drugs are taken during pregnancy without proper guidance of health professionals. Then, the next one is drug misuse. Drug misuse naman is common to sa medication in a way that can be harmful to your health. This include taking too much of medication or taking it for too long or even mixing different medication together. Both over-the-counter or OTC drugs and prescription can be misused. Some example is the common misuse of OT drugs like laxatives, antacids, vitamins, headache remedies, cough and cold medication. Sa drug misuse naman is yung maling paggamit ng drugs. While most people do not experience any negative effect from these drugs when used properly, some people may suffer serious side effects if they are not used correctly naman. For example, nag-use ako ng over-the-counter cough medicine to treat my persistent cough without realizing that there is underlying cause of cough, that something serious like throat cancer. So, it is important to always read the label on your own medication carefully and follow instructions provided by the doctor or pharmacist. Drug abuse naman is refer to taking a substance or a drug that is inappropriate way, either continually or periodically. Whether drug is used to consider abusive, it depends on society's views of it. For example, pag-drink ng alcohol sa work is hindi pwede, kino-consider yun siya as alcohol abuse. While kapag nasa inuman ka, na social gathering, pwede maging okay or hindi siya drug abuse in view with that. And the next one is drug abuse have two main aspects. First is drug dependence and habituation. So, drug dependence means relying or needing to take a drug or substance regularly. There are two different types of dependence, the physiologic and psychologic, which can occur separately or together. Pwede siya maging um, one by one or pwede sila both. Physiologic dependence happen when there are biochemical changes in body tissues, especially nervous system, that come to require the substance for normal functioning. So when someone is dependent and stop using drug, they may experience withdrawal symptoms. While the psychological dependence naman is emotional reliance on drugs to maintain your sense of well-being, accompanied by your feelings of need or cravings for that particular drug. The degree of psychological dependency varies from mild desire to craving and compulsive use of drug. So, sa drug dependence, ang physiologic naman is yung talagang need ng katawan mo, while sa psychologic naman is yung mind mo na or mentally is kinakrave niya na pwede siya maging compulsive kasi naging reliance ka sa drug na hindi naman dapat pwede. Then the next one is drug habituation. Habituation refers to if a person becomes psychologically or mentally dependent on taking certain substance such as drug, this means that a person has developed a habit of taking the drug and feels better after doing so. Even if it's harmful to their health, they may continue to take the drug because of its psychological dependence. It is important to note that it's not the same as addiction, which involve physical dependence on a substance and more severe consequences. So, sa drug habituation naman is talagang you are mentally linked or connected ka na talaga na gamitin yung drug palagi kasi habit mo na yun siya. When you think of a drug, normally, nagka-crave ka na talaga sa certain drug na yun. Kahit hindi siya, hindi siya good sa health mo, but nasanay ka na, yan yung tinatawag natin na drug habituation. Then the next one is the illicit drug. Illicit drugs are also known as street drugs. These drugs are sold illegally. Ito naman yung drug na to is binebenta siya na illegal. There are two types of illicit drugs. The first one is the drugs that cannot be purchased legally under circumstances such as heroin. And the second one is those drugs can only obtain with a prescription but they are being acquired through illegal means. So, yung first street drugs is hindi mo siya mapapurchase legal under circumstances because bawal siya. And yung second naman is ma-obtain mo siya or makukuha mo siya with prescription pero ginagamit mo siya through illegal. This is when people take this type of drugs because they believe their body can alter their mood or making them happy or satisfied. Then the next one is the action of drugs. When we take medicine, it usually goes in our body and starts working. The amount of medication in our bodies over time as the body gets rid over it. We can measure these changes using something called half-life. Half-life is the amount of time it takes the body to get rid of half or 50% of the medicine in our system. For example, if merong drug life na 8 hours, then after 8 hours, they will be only half or become 50% na lang sila as much medicines left in our system. So the doctors want to keep a certain level of medication in our bodies so that we can alter to get better. To do this, we need to give us dosage throughout the day or week. When we take this by pills or mouth, through mouth, they can go with our stomach and absorb in our bloodstream slowly over time until they reach the highest point or the called peak plasma level. But when the doctor give us drug through an IV or needle, the medicine immediately enters our bloodstream at its highest level concentration and then decreases over time. So, yan naman yun. So, magkaiba talaga pag oral route administration compared to IV or intravenous. Mas mabilis yung concentration through skin unlike sa digestive na natutunaw pa siya through digestion. So, the next one is some key terms related to how medicine works include. For the first one is the onset action. Ito naman is when you start feeling better after taking medication. Second is the peak plasma level. Ito naman is yung highest concentration na achieve na isang dose. Drug half-life naman is how long it takes for our body to eliminate half of what was taken initially. Plot U naman is maintaining a constant concentration during scheduled dosage. Then the next one is the pharmacodynamics. Pharmacodynamics is how drugs work in the body and how they affect us. When we take drugs, it targets specific parts of our cells called receptors. And the receptor are usually protein sila on the surface inside or outside of our cells that help them to function normally. Drugs can either enhance or inhibit this normal function. Most drugs work chemically binding with this receptor at cellular level. This interaction between the drug and receptor produce pharmacologic effect, which can either agonism or antagonism. So, when we say agonist, agonists produce the same response as natural substance in our body, while the antagonist naman is piniprevent niya from producing natural body substance from activating cell functions by occupying receptor sites. Then the next one is the pharmacokinetics. Pharmacokinetics is a scientific field that focuses on how drugs are processed by the body. So ito naman yung pharmacokinetics is malalaman natin kung paano yung process ng drugs sa ating katawan. So when we say process, this includes studying on how drugs are absorbed into the bloodstream, how they move throughout the body, and how they are transformed or broken down by different organs. Finally, pharmacokinetics are also examine how drugs leave the body through the process like excretion. By understanding these processes, scientists can develop more effective medication and ensures patients receive safe dosage of medication for specific needs. So the pharmacokinetics, the first process is absorption, second is distribution, third is biotransformation, and last is the execution. For the first one is the absorption. Absorption is when a drug enters the bloodstream. This is usually the first step in how drug move toward your body after you take it. The way you take the drugs, how well and how quickly it will be absorbed in your bloodstream. For example, if I swallow a pill, it has go through your stomach before it can enter your bloodstream. However, not all drugs are absorbed at the same rate in the stomach. Some may be absorbed faster or slower than the others, depending on their form and route of administration. So, sa pag-absorb, pwede siya maging pwede yung route of administration, pwede siyang oral, which means mas mabagal siya compare sa IV or through skin, na kapag sa skin kasi is mas high yung concentration ng drugs, mas mag-direct siya sa bloodstream. Unlike sa oral is mada-digest muna siya through digestion before pupunta sa bloodstream. So basically, mas mabagal yung distribution sa absorption pag oral compared to IV. Then the next one is the distribution. Distribution naman is how a drug moves from where it enters the body before where it enters needs to go. When a drug gets into your bloodstream, pag nasa bloodstream na yung drug, it goes first to the organs that have a lots of blood flowing through them, like your liver, kidneys, and brains. Area with less blood flow will like skin and muscles get the drug later on pa. The properties of drug itself decide where in the body it will go. For example, if drug can dissolve in fat, it will build fat it will build fatty tissue, while other drugs attach themselves to proteins in your blood called plasma protein. Then the next one is the biotransformation. Biotransformation naman is also called the what we call detoxification or metabolism. Ito naman is process on which drug are changed into less active form. This process mostly happen in our liver, where enzymes are worked to make ensure that the drugs don't harm our body. The new products created from this process are called metabolites. Metabolites are two types, which is active and inactive. Active metabolites have effect on our body, while the inactive metabolites don't have. So if someone is very young or old or merong unhealthy liver, nangyayari yung biotransformation. So, the nurses need to be careful because if the drug doesn't get broken down properly, it can build up in their system and cause serious problem. Then the next one is the execution, the last process. So execution is a process that helps the body get rid of waste products and drugs. When our bodies break down food or medicine, they produce byproduct called metabolites. These need to be eliminated rather from our system so that we stay healthy. The kidneys play a crucial role in execution as they help eliminate most drug metabolites through urine. However, some of them also remove from the body through other ways like feces or poop, breath, sweat, saliva, and breast milk. Some drugs, as general aesthetic agents, require special attention during execution because these substances have strong effect on the body even unintended use has ended. Therefore, it is important to ensure proper elimination of these drugs from the body. Then the next one is factors affecting medication. So when someone takes a drug, there are other things that can affect how the drug works in our body beside the drug itself. For example, even if they take the same amount of drug multiple times, their body may not react to it in exactly the same every time. Also, people could take exact same drug and dosage but have different reaction to it because everyone's body is unique. So the first one is the gender development, second is gender, third is genetic and cultural factor, four diet, five environment, six is psychological factor, seven illness and diseases, and lastly is the time of administration. So when we say genetic gender development, so there are different types of or stages of life that can affect the way people react to medication. So halimbawa during pregnancy, usually yung babae is need maging extra careful within drugs kasi um pwede siya maging harm sa pagdevelop ng fetus during the first trimester when organs and functions are forming pa lang. Infants naman need smaller dosage of medication because their body are still growing and their organs are not fully developed yet. Sa adults naman or adolescents, pwede silang magka-develop ng allergy sa drugs, and as we get older naman, our bodies changes in a way that make us feel more sensitive to medication. So for example, between an older age, usually kapag matanda na, our liver and kidneys may not work as well as they used to, which means drugs might stay in our system longer than they should. At older adults naman, nagkakaroon sila ng trouble absorbing medication or experience of drug toxicity if their body composition changes or meron silang mas madaming fat mass. And these changes in protein binding sites and blood-brain barrier function that occur with aging could also impact drug effects on our body. It is important to consider development factors when prescribing medication, so para malaman natin if the patient must receive safe and effective treatment based on their current stage of life. Then the next one is the gender. Talking about men and women can respond differently to drugs. So the main reason po nito is because men and women have different amount of body fat, fluid, hormones in our bodies. Since most drug research is done on men, it is important to do more research on women so that we can understand how hormonal changes affect the way of drugs work in our bodies. Then the third one is the genetic and cultural factors. So paano or the way our genes naman put together can have impact on how we respond to certain medication. So, some scientists study the relationship between genetic and drug response. This is the called this study called is pharmacogenomics, and this field combines knowledge of drugs or pharmacology with the study of entire genetic makeup or genomics to see how different genes affect of how our body react to medicine. So sometimes people use the term pharmacogenetics instead, which refers specifically to how differences in just few genes can influence how someone respond to one particular medication. So talking about how cultural factors and practices like belief and values affect how drug works. For an instance, taking paggamit ng herbal remedy like ginseng alongside prescribed medication can either speed up or slow down the medication by process in our body. The next one is diet. So, nutrients, which are the thing of our bodies need to grow and function properly, like vitamins and minerals, and actually change how medication work. One of the example is the vitamin K. Vitamin K usually found in green leafy vegetables like spinach and kale. It is important for our blood clot when we get cut or injury. But if we take too much vitamin K, taking of it called warfarin or also known as comadin, it can make the medicine less effective at thinning our blood. And this could be lead to dangerous because if blood doesn't clot properly when it needs to, we could bleed too much. So basically, nutrients from food can either help or hinder how well certain medication work in our body. That's why it is important na to talk with our doctor or pharmacist about any vitamins or supplements before taking it. Then the next one is the environment. Um, when we say environment, it talks about temperature and noises that can affect the way drug works in our body. When it's hot outside, our blood vessels get bigger, which makes certain types of medication work better. But pag malamig naman, our blood vessels get smaller naman, which can make medication less effective. So, in addition to temperature, noise level also play in drug effectiveness. So, if you are a sedative or painkiller in noisy environment like busy street or construction site, hindi yun mag-work well. If nasa quiet place ka naman, the noise become interfere its side effects. So basically, the environment can impact on how well medication work for us, and it is important to become aware of these factors when taking medication. So the next one is physiologic factors is it talks naman about um how person expectation affect their response to medication. Specifically, if someone naniniwala that a certain drug won't work for them, they may not feel much or any relief from pain even after taking from it. This shows that our beliefs and attitudes can impact on how treatment works. So it is important to trust the effectiveness of medication prescribed by the healthcare professional and keep an open mind about their potential benefit. The seventh is illness and diseases. Illness and diseases can have impact of how drug works in our body. For example, if someone has a fever and nag-take siya ng aspirin to lower the body temperature. So, if someone doesn't have a fever naman tapos aspirin won't affect the body temperature at all. The way the drug works also change when someone has problem with their circulation, liver, or kidneys. And the last one is the time of administration. When you take when you took a medicine by mouth, the time at which you take it can affect how quickly it works. So, some medicine are absorbed faster when your stomach is empty, with some others better if you take them with food. This which means that taking certain medications um will yes, taking certain medication will work quickly and effectively while other medicines need to take to have the side effect. It's also important to follow doctors or pharmacist instruction for taking medication. Then the next one naman is medication of or medication order. So talking about how medication orders, it usually nalalaman ito and prescribed by the healthcare setting. Typically, if a physician or a doctor will determine what medication a patient needs and write an order for those drugs. So the first one is the nurse must know or must write down the order exactly as it was given or prescribed and read it back to make sure that there is no mistake. So there are types of medication orders. So the four common types of medication orders that doctor use, and these orders help to ensure that the patient receive the correct medication at right time in a proper dosage. So, right time, right dosage, right medication, yan yun dapat i-ensure natin before administering medication. So, the first type is called the stat order, which means that medication should be given immediately or agad-agad and only once. An example of this would be if someone is nag-experience siya ng severe pain and kailangan niya ng warfarin sulfate na 10 milligrams IV stat to relieve it quickly yung first or stat order. The second type is the single order or one-time order, which means naman that the medication should be given only once at specific time. For example, the Seconal 100 milligrams might be prescribed for a patient to take before surgery as part of their pre or pre-operative operation. So, meron siyang specific time at once lang ine introduce sa patient. Then the next one is the other type of order is called the standing order, which may or may not have an end date. So, pwede siyang magkaroon ng end date or pwede naman wala. This means that the nurse can give the medication on a regular basis until there is an order to stop, or pwede man specific number of days lang. Sometimes these orders are automatically cancelled after certain amount of time and needed to be ordered again. And the last type of order is called the PRN or PERN as needed order. Ito naman is inaalaw niya yung nurse na magbigay ng medication only when they think it is necessary based on their judgment and assessment on the patient condition. So, ito naman is binibigay na niya yung medication if kailangan talaga ng pasyente. So, the nurse need to use good judgment in deciding when and how much medication should be given safely. So, there are essential parts of a drug order. So, here's are the following. The first one is the full name of the client. Second is the date and time the order is written. Third is the name of drug to be administered, dosage of drug, frequency of administration, route of administration, and signature of an individual writing the order. So, in parts of prescription, there is descriptive information about the client name, address, and age. Second is date on which the prescription was written, the RX symbol meaning the take due, medication, name, dosage, and strength, route of administration, oral ba siya or through IV ba, and etc. Dispensing instruction for the pharmacist, for example, dispense 30 capsule. Direction for administration to be given for the client, for example, taken on an empty stomach. Next is refill and special labeling, for example, refill less than 1, and prescriber's signature. Then the next one is communicating a medical order. So, halimbawa, pag a patient naman kailangan niya ng medication, the doctor or nurse will write down the order of medication on their medical chart. Sometimes, if the doctor is not available in person, they may give this order over through the phone through a nurse. Or in some hospital, there are rules about how quickly the doctor must review and approve these orders within 24 or 48 hours. Once na ma-approve iyon, the nurse will copy the information onto special form that help them to keep track and when and how much medication should be given to the patient. But nowadays, many nurses receive this information electronically instead of paper copies from the doctor, which can help reduce errors and save time. So, as a nurse, it is important to question any medication order that seem unclear or unsuitable for the patient's condition. If you believe that an order is inappropriate, you should contact the primary care provider and discuss. So, yun.
Additionally, if someone else give medication instead yourself, instead ikaw dapat, it is important to record information about the patient's conditions before and taking it. Lastly, if an incident report needs to be filled because of this issue, make sure only factual information is included in your document. So for the next one is the metric system. So the two system of metric measurement commonly used in North America is the metric system and the household system. The metric system naman is ginagamitan siya ng decimal base system that uses 10 or making it easier to convert between different units. The basic unit measurement are the meter for length, liter for volume, and gram for weight. Prefixes like deci, centi, and milli designate smaller subdivisions, while prefixes like deca, hecta, and kilo designate larger multiples. In nursing practice review, it is important to understand the difference between the weight, grams, milligrams, and volumes ml because drugs may be ordered by weight but administered by volume. For example, if a healthcare provider prescribed 20 mg of codeine in liquid from label as 10 mg per 5 ml bottle, then nurse would administer 10 ml of codexine elixir. While the household system naman is less precise than metric system but can useful when more accurate measures aren't necessary. Household measures include drops, teaspoon, and tablespoon. Some approximate conversions between metric and household system include 15 drops is equivalent to 1 ml, 4 ml is equivalent to 1 teaspoon, and 15 ml is equal to 1 tablespoon. Overall, this understanding the different system measurement is important for accurately administering medication in nursing practice. That would be all. Thank you.
Good day everyone, I am Micaela Lefumoto and I will be discussing first the routes of administration. So first is the oral route. Oral administration is the most common, least expensive, and most convenient route for most clients. So in oral administration, the drug is swallowed. So yung medication is taken by mouth and swallowed. So common example nito is yung mga tablets, capsule, and syrup. So this route is used for a wide range of medication from pain relievers to antibiotics. Next is the sublingual route. In sublingual administration, a drug is placed under the tongue where it dissolved. So in sublingual, yung medication niya is placed under the tongue and absorbed directly into the bloodstream through the mucous membrane. Example include yung sublingual tablets for rapid relief of chest pain or sublingual drops for a certain vitamins and minerals. Next is the buccal route. Buccal means pertaining to the cheek. In buccal administration, a medication is held in the mouth against the mucous membranes of the cheek until the drug dissolves. So in buccal, yung medication is placed between the cheek and gum where it is absorbed to the mucous membrane. So buccal administration is often used for medication that requires rapid absorption, such as certain pain relievers and anti-nausea medication. So next is the parenteral route. The parenteral route is defined as the other than through the alimentary or respiratory tract, that is by needle. So in parenteral, we have subcutaneous, intramuscular, intravenous, intradermal, and intraspinal. Next is topical route. Topical application are those applied locally to the skin or to the mucous membrane. So in topical route, medication is applied directly to the skin or mucous membranes for local effect. Example, yung mga creams, ointments, and eye drops. So this route is used for conditions such as skin infection, inflammation, and eye disorders. So the topical application include the following: dermatologic preparation applied to the skin, instillation and irrigation applied into the body cavities or orifice, and inhalation administered into respiratory tract by a nebulizer or positive pressure breathing apparatus. So here are the routes for opioid delivery. So first is the oral, transnasal, transdermal, transmucosal, rectal, subcutaneous, intramuscular, intravenous, and intraspinal. First is the oral. The oral route is preferred for opioids because of ease of administration. So in oral, commonly used for long-term pain management and conditions like cancer. Next is the transnasal. Transnasal administration has the advantage of the rapid action of the medication because of direct absorption through the vascular nasal mucosa. So intense nasal provides rapid pain relief, especially for breakthrough pain and cancer patients. Next is the transdermal. Transdermal drug therapy is advantageous in that it delivers a relatively stable plasma drug during level and non-invasive. So, and transdermal offers continuous pain relief over time. So, suitable siya for chronic conditions such as osteoarthritis. So next is the intramuscular. The intramuscular route should not be used for administration of analgesics. So an intramuscular provides rapid pain relief and emergency situation. Next is the intravenous. The IV route, the most rapid onset pain relief with few side effects. So IV medication should be given slowly to decrease adverse effects. So, and intravenous is administered directly into a vein for immediate pain relief, commonly used during surgery or in emergency. So, next is intraspinal. Intraspinal infusion may be administered to clients who require pain management and variety of practice setting, example acute care, outpatient, and home care. In intraspinal offers patent pain relief for severe pain, particularly in the cancer patient or certain surgical procedure. Next is the continuous local anesthetics. So, continuous subcutaneous administration of long-acting local anesthetic into or near a surgical site is a technique that can be used to provide post-operative pain control. So this technique has been used for a variety of surgical procedures including knee arthroplasty, abdominal hysterectomy, hernia repair, and mastectomy. So in continuous local anesthetic, usual for prolonged pain management in a specific area such as during and after surgery or for chronic pain condition like neuropathy. So in administering medication, so involves the process of giving medication to patient, ensuring the correct dosage, route, and timing according to prescription or healthcare provider instruction. Next is the medication administration errors. So medication errors cause at least one death every day and ensure approximately 1.3 million people annually in the United States alone, according to World Health Organization 2017. So medication errors can occur at all stages of the medication administering process, prescribing, transcribing, dispensing, administering, or monitoring. So nurses who do not follow the five rights, the right drug, right client, right dose, right time, right route of medication administration contribute to medical errors. So, and medication administration error refers to mistake made during the administration of medication, which can lead to adverse effect of lack of efficacy, highlighting the importance of accurate medication administration practices. Next is the medication reconciliation. The Institute of Healthcare Improvement defines medication reconciliation as the process of identifying the most accurate list possible of all medication a patient is taking, including name, dosage, frequency, and route, and using this list to provide correct medication for patient anywhere within the healthcare system. So, in medication reconciliation, so you should ensure accurate and up-to-date medication list for patient, reconciling differences between what patient were taking prior to admission and what they are prescribed during their hospital stay, so reducing the risk of adverse drug events. So next is the medication dispensing system. So first is the medication chart. The medication chart is on wheels, allowing the nurse to move the chart to outside the client's room. So the medication chart is ito yung portable storage units used by the healthcare provider to provide transport and administer medication to patient, especially in hospital or long-term care facilities. Next is the medication cabinet. This cabinet holds the client unit dose medication and MAR. So, in medication cabinet, ito yung fixed storage units na located in the healthcare facilities, storing medication securely and allowing healthcare provider easy access for administration. Next is the medication room. The medication room may also be the central location for stock medication, controlled medication, and drug use for emergencies. So, in-room medication, ito yung dedicated area within a healthcare facility for preparing and dispensing medication and ensuring organization, cleanliness, and safety during medication handling. Next is the Automated Dispensing Cabinet or ADC. This computerized access system automates the distribution, management, and control of medication. So, automated dispensing cabinet, ito yung electronically controlled storage unit na securely stores and dispense medication. So, often used in hospitals to streamline medication distribution and improve inventory management. So, here are the 6 process of administering medication. First is identify the client. So, in identifying the client, you should confirm the correct patient to prevent errors. Next is inform the client. So, informing the client, explain the medication, dosage, and any potential side effect. Next is administer the drug. So, so you should give the medication according to prescribed instruction. Next is provide assistive interventional as indicated. So offer support or assistance needed during administration. Next is record the drug administered. So document the medication given, dosage, and time. And last, evaluate the client's response to drug. So, monitor for any reaction or changes after administration. Next is developmental consideration. So, infant and children. Knowledge of growth and development is essential for nurses to administering medication to children. Oral medication for children are usually prepared in sweetened liquid form to make them more palatable. So, developmental consideration in various stages of life, like infancy and childhood and older adulthood, involve understanding unique needs, abilities, and challenges at each other. For the infant and children, it focuses on the early growth, motor skills, language acquisition, and cognitive development. So in older adults can have special problems, most of which are related to physiologic changes, to past experiences, and to establish attitude towards medication. So, in older adults, it involves addressing issues related to aging, such as health concerns, cognitive decline, and social adjustment. Next is the oral medication. The oral route is the most common route by which medication are given. As long as the client can swallow and retain the drug in the stomach, this is the route of choice. Next is the nasogastric and gastrostomy medication. So clients who are NPO for an extended time will often need internal feedings delivered by a tube. A nasogastric tube or a gastrostomy tube, in addition to providing nutrition, is also an alternative route for administering medication through nasogastric or gastrostomy tube. So these are medication administered orally or through a tube inserted into the stomach via the nose or the nasogastric, or directly through a surgical opening in the abdomen or gastrostomy. So they are commonly used for patients who cannot take medication by mouth. A nasogastric tube is inserted by the way of the nasopharynx, as placed into the client's stomach for the purpose of feeding the client or to remove the gastric secretion. A gastrostomy tube is surgically placed directly into the client's stomach and provides another route for administering medication and nutrition. Next is the parenteral medication. Parenteral administration of medication is a common nursing procedure. Nurses give parenteral medication intradermally, subcutaneously, intramuscularly, or intravenously. So these are medication administered by injection rather than through the digestive system. So they bypass the gastrointestinal tract and are typically given intravenously, intramuscularly, or subcutaneously. Next is the syringe. Syringe is a device used to inject or withdraw fluid. It contains of a barrel, plunger, and tip. The three parts of a syringe: first is a tip which connects with the needle, the barrel or the outside part, which the scale are printed, and the plunger which fit inside the barrel. A hypodermic syringe comes in 3 and 5 ml sizes, so used for injecting substance beneath the skin or into muscles. Next is the Durlock, sometimes spelled Durlock or non-Durlock, also known as a slip tip syringe. Has a tip that requires the needle to be twisted onto it to avoid accidental removal of the needle. Slip tip syringe has a smooth graduated tip and needles are slipped onto it. The larger 60 ml non-Durlock syringe is often used for irrigation purposes, example wounds and tubes. Next is the insulin syringe. An insulin syringe is similar to a hypodermic syringe, but the scale is especially designed for insulin. A 100 unit calibrated scale intended for use with U100 insulin. This is the only syringe that should be used to administer insulin. So, specifically designed for administering insulin, typically with a short, thin needle. Next is the tuberculin syringe. The tuberculin syringe was originally designed to administer tuberculin solution. It is a narrow syringe calibrated in tenths and hundreds of millimeter up to 1 ml on one scale, and in 16th of a minim up to 1 minim of the other scale. So the tuberculin syringe, a small syringe used for injecting small doses of medication, often used in diagnostic tests. So needles are made of stainless steel and most are disposable. So the three parts of a needle, the hub which fits onto the syringe, the cannula or shaft is attached to the hub, the bevel, the slanted part at the tip of the needle that helps the needle cut through the skin with minimal trauma. So the needles are sharp and pointed device attached to the syringe for piercing the skin or tissues for injection or aspiration. So yung hub is a part of the needle na naka-attach sa syringe and the cannula is yung hollow na cylindrical part sang needle na gina-allow yung medication to flow. And the bevel is yung slanted tip of the needle na pina-facilitate yung insertion sa skin or tissue. Next is preventing needle stick injuries. One of the most potentially hazardous procedures that healthcare personnel face is using and disposing of needles and sharps. Needle stick injuries present a major risk for infection with hepatitis B virus, HIV, and many other pathogens. So proper handling and disposal of needles and other sharp objects using safety engineered devices like retractable needles to minimize the risk of accidental needle stick. Safe needles disposal practice to prevent injuries to the health care workers and others. Next is the ampules and vials are frequently used to package sterile parenteral medication. So an ampule is a glass container usually designed to hold a single dose of drug. It is made of clear glass and has a distinctive shape with a constricted neck. Ampules vary in size from 1 to 10 ml or more. A vial is a small glass bottle with a sealed rubber cap. So these are containers used to hold liquid medication. Ampules are sealed glass containers na need to be broken open, while the vials have the rubber stoppers that can be pierced with a needle. Next is the two examples of the preparation of powdered drugs. So first is the single dose vial. Instruction for preparation an SVD state that 1.5 ml of sterile water is to be added to the sterile dry powder, thus providing a single dose of 2 ml. So when single dose, yung medication is nakapack in a single dose are intended for use by a single patient at one time to prevent contamination and ensure accurate dosing. Next is the multi-dose vial. A dose of 750 mg or milligram of a certain drug is ordered for a client. On hand is a 10 grams multi-dose vial. So, in the multi-dose vial, ito yung vials contain multiple doses of medication and nag-require siya ng proper handling and storage to prevent contamination between uses. Next is for the injection techniques, an intradermal or IV injection and the administration of a drug into the dermal layer of the skin just beneath the epidermis. So, when administering into the dermis layer of the skin, typically for skin testing or vaccination. Next is subcutaneous injection. Among the many kinds of drugs administered subcutaneously are vaccine, insulin, and heparin. Common sites for subcutaneous injection are the outer aspect of the upper arm and the anterior aspect of the thigh. So, in the subcutaneous injection, so injected siya sa layer of the tissues below the skin, commonly used siya for medication like insulin or certain vaccine. The intramuscular injection into the muscle tissue or intramuscular injection are absorbed more quickly than subcutaneous injection because of the greater blood supply to the body muscle. So the intramuscular injection administered into the muscle, so allowing for faster absorption compared to subcutaneous injection. So next is the injection site. First is the ventrogluteal site. So is in the gluteus medius muscle, which lies over the gluteus minimus. So the ventrogluteal site is preferred site for intramuscular injection because the area contains no large nerves or blood vessels, provides the greatest thickness of gluteal muscles consisting of both the gluteus medius and gluteus minimus, is sealed off by bone, contains consistently less fat than the buttock area, thus eliminating the need to determine the depth of subcutaneous fat. So in the ventrogluteal site, located siya sa hip, it is the common site for intramuscular injection due to its thick muscle and reduced risk of nerve or blood vessel injury. Next is the vastus lateralis muscle is usually thick and well developed in both adults and children. It is recommended as the site of choice for IM injection for infants and young children because it is the largest muscle mass. So the vastus lateralis, ito yung the outer thick muscle often used for intramuscular injection in infants and small children. Next is the rectus lateralis. The rectus femoris muscle, which belongs to the quadricep muscle group, is used only occasionally for IM injection. It is situated on the anterior aspect of the thighs. So, in rectus lateralis, yung muscle on the outer aspect of the thigh is used for intramuscular injection in adults. Next is the deltoid side. The deltoid muscle is found on the uppermost part of the upper arm. It is a relatively small muscle. No more than 1 ml of solution can be administered. This site is recommended for the administration of immunization and vaccines in adults because these medications are usually small in volume. So the deltoid side is the muscle at the upper arm, commonly used for vaccines and certain medication.
Topical medication. A topical medication is applied locally to skin or mucous membranes in areas such as the eyes, in external air canal, nose, and rectum, undesirable ones. A particular type of topical or dermatologic medication delivery system is the transmental patch. So, ang topical medication, pwede siya ma-apply directly sa ating skin with various conditions such as acne, eczema, tapos and nag-relieve to eczema to pain and anti-inflammatory purposes. They like come in various forms just like creams, ointment, gels, lotion, or patches and can deliver drugs locally or systematically depending on the condition being treated. Next is sa skin application. Topical skin or dermatologic preparations include ointments, paste, creams, lotions, powder sprays, and patches. Ang skin application is nag-refer siya, refer to any substances or medications apply directly sa ating skin. Ano nga, yung may include creams, lotion, gels, patches, and ointment. Skin applications are commonly used for treating a wide range of conditions, including na doon yung skin infection, inflammation, dryness, itching, and more. They can also be used for cosmetic purposes such as moisturizing and anti-aging or sun protection. Next is the ophthalmic medication. Ophthalmic medications may be administered to eye using irrigations or instillation. An eye irrigation is administered to wash out the conjunctival sac to remove secretions of foreign bodies or to remove chemicals that may injure the eye. Ophthalmic medication for the eye is called ophthalmic medication nga. So, bale din yung ophthalmic medication, meron din silang various forms such as eye drops, ointments, or gels are used to treat eye condition. Para sa such as like infection, inflammation, glaucoma, allergies, dry eyes, and more. These medicines makahelp sila to alleviate symptoms, improve vision, or to prevent further damage to the eyes. Next naman is ang otic medication. Otic medication, installation or irrigations of an external auditory canal are referred to as otic and are generally carried out for cleaning purposes. Ang otic medications, especially designed siya for application to the ears. Nagana din siya sa various forms such as air drops or ointments and are used na use siya to treat air infections, inflammations, pain, or to remove yung wax na nag-build up. Next is nasal medication. Nasal installations, nose drops and sprays usually are instilled for their strange effect to shrink swollen mucous membrane, to loosen secretions and facilitate drainage, to treat infection of a nasal cavity or sinuses. So, bale, ang nasal medication is naga-form siya, come in different forms like nasal sprays, drops, or inhalers. Ginagamit sila para matreat ang condition like if ang patient merong allergies, congestion, or sinus infections. Next is the vaginal medications. Um, Vaginal medications are inserted as creams, jellies, foams, or suppositories to treat infections or to relieve vaginal discomfort. Ang vaginal medication, formulated siya for a vaginal area. They come in various forms such as creams, suppositories, tablets, or gels. Minsan ginagamit siya to treat condition such as vaginal infection, vaginal yeast infection, bacterial vaginosis, vaginal dryness, or certain types of contraception. Vaginal medication, pwede din siyang ng medications, taga-contain siya ng antifungals, antibiotics, hormones or lubricants, depende sa condition na being treated. So, bali important din na to follow the instructions na provided ng healthcare providers for proper administration and effectiveness. Next is the inhaled medication. Medications are delivered to the respiratory system by aerosol therapy. An aerosol is a suspension of minute liquid, droplets, or fine solid particles suspended in gas. Ang inhaled medications ng drugs that are administered directly sa ating lungs via inhalation na commonly used siya to treat respiratory conditions such as ng asthma, chronic obstructive pulmonary disease, cystic fibrosis, and respiratory infections. Inhaled medication can come in various forms ng including na yung metered dose inhalers, dry powders inhalers, in nebulizers and nasal sprays. Um, this medication often include dilators, corticosteroids, anticholinergics, or antibiotics depending sa condition of being treated. Um, Proper inhalation technique is crucial for their effectiveness, um, and it is essential to follow instruction provided by the healthcare professionals. Next is irrigations. An irrigation lavage is a washout of a body cavity by stream of water or other fluid that may or not be medicated. Irrigation is performed for one or more of the following reasons. To clean the area, that is to remove a foreign object or excessive secretions or discharge. Um, there are four types of syringe used for irrigation. First is the asepto. Ito. Asepto. Asepto is a plastic or glass syringe with a rubber bulb. Squeezing the air out of bulb nagaproduce siya sang negative pressure and fluid can be sucked into the syringe. Next naman is the rubber bulb. Rubber bulb is a syringe is often used for irrigating sa air. So sa air siya ginagamit. Like the acceptor syringe, the rubber bulb comes in a range of size. Next naman is yung piston syringe. Piston syringe, which has a tip to which catheter can be attached, and the Pomeroy syringe. Pomeroy syringe. And lastly is the Pomeroy syringe is a metal syringe commonly used for ng air irrigation, a shield near the tip solution spraying outward. Next is skin integrity. Skin integrity. Intact skin refers to the presence of normal skin and skin layers uninterrupted by wounds. Genetics and heredity determine many aspects for an individuals, including skin color, sensitivity to sunlight, and allergies. Um, Skin integrity is refers to the overall health and condition of the skin, including its structure, elasticity, and ability to resist damage. If ma-maintain natin yung skin integrity, maka-prevent ng essential siya para ma-prevent natin yung wounds, infections, and other skin-related issues. May factors din na maka-affect sa skin integrity, including na doon yung hydration levels, nutrition, blood flow, mobility, and exposure to irritants or trauma. Proper skincare, hydration, nutrition, and avoiding prolonged pressure or friction in the skin are essential for preserving skin integrity. Next is types of wounds. Body wounds are either intentional or unintentional. Intentional trauma occurs during therapy. Examples are operations. Unintentional wounds are accidentally, for example, client may fracture an arm in an automobile collision. Clean wounds are unaffected wounds in which there is minimal inflammation and the gastrointestinal, genital, and urinary tracts are not entered. Clean wounds are primarily closed wounds. Clean contaminated wounds are surgical wounds in which contaminated wounds include open, accidental, and surgical wounds involving a major break in sterile technique or splanage. From gastrointestinal tract, contaminated wounds show evidence of inflammation. Kapag contaminated na daw yung wounds ng patient, naga hubag siya, basta yung ginatawag dry, Dirty infected wounds include wounds with evidence of clinical infection such as purulent drainage or necrosis. So there are different types of wounds. First is the incision causing a sharp instrument. Example is knife or scalpel. Description and characteristic. Open wound deep or shallow once the edge been sealed together as a part treatment incision becomes closed wound. Next is contusion, blow from a blunt instrument. Closed wound, skin appears ecchymotic because damage blood vessels. Next is abrasion, surface scrape, either unintentional scrape knee from a fall or intentional dermal abrasion to remove pock marks. Open wound involving the skin. Puncture, penetration of the skin and other than the underlying tissues by a sharp instrument, either unintentional or intentional. An open wound. Next is laceration. Tissues turn apart, often from accidents with machinery. Open wounds edges are often jagged. Next is penetrating wound. Penetrating of the skin and underlying tissues, usually unintentional from bullet or metal fragments. Open wound. Next is pressure injury. Pressure injuries consist of injury to the skin or underlying tissue, usually over a bony prominence as a result of force alone in a combination with movement. Pressure injuries were previously called pressure ulcers, decubitus ulcers, pressure sores, or bed sores. So, bali, ang pressure injury, localize siya damage to sa ating skin and underlying tissue, usually bony prominence. Nag-result siya sa prolonged na pressure or pressure combined with shear forces. Nag-occur siya sa individuals or patient na bedridden or nagagamit ng wheelchairs or have a limited mobility. Ang pressure injuries nag-range siya from mild reddening of the skin to severe tissue damage, including open wounds. Ang common sites ng pressure injuries is nag-include siya sa sacrum, heels, hips at saka sa elbows. Para ma-prevent natin to is there are strategies nag-include sa regular repositioning, proper cushioning and support surface, good nutrition, and maintaining skin hygiene. Next is etiology of pressure injuries. Pressure injuries are due to localized ischemia, a deficiency in the blood supply to the tissue. The tissue is compressed between two surfaces, usually the surface or furniture such as the bed or chair and the bony skeleton. When pressure is relieved, the skin takes on a bright red flash or erythema called reactive hyperemia. In dark-skinned client, both the blanch and flush may be difficult to detect. So, bale, ang etiology pressure is a combination siya ng factors of primary pressure, shear, and friction. Ang prolonged na pressure sa skin, often over bony prominences, like sa sacrum natin, heels, hips, or elbows, nagakos siya na mag-restrict yung blood flow, nagalid daw siya sa ischemia or lack of blood flow. Next is makaano din siya ng tissue damage and ultimate pressure injuries. Next is risk factors. Several factors contribute to the formation of pressure injuries. Friction and sharing, immobility, and inadequate nutrition, fecal and urinary incontinence, decreased mental status, diminished sensation, excessive body heat, advanced age, and the presence of certain chronic conditions. So there are several factors increase the risk of developing pressure injuries. First is the fraction and sharing. Fraction and sharing, rubbing against surface and shear forces which occur when skin moves one way and underlying tissues move other can contribute to tissue damage. Next is the immobility. Immobility, individuals who are bedridden or yung patient na nakoma, yung naka-wheelchair bound or have limited mobility are the higher risk due to prolonged pressure on the specific body areas. Next is inadequate nutrition. Inadequate nutrition. Prolonged and adequate nutrition uses weight loss, muscle atrophy, and the loss of subcutaneous tissue. These three conditions reduce the amount of padding between the skin and the bones, thus increasing the risk of pressure injury. Hypoproteinemia or abnormal low protein content in the blood due either to inadequate intake or abnormal loss predisposes in clients to dependent edema. Edema and the presence of excess interstitial fluid makes skin more prone to injury by decreasing its elasticity and reliance and vitality. Next is the fecal and urinary incontinence. Fecal and urinary incontinence. Moisture from incontinence promotes skin maceration, tissues softened by prolonged wetting or soaking, and makes the epidermis more easily eroded and susceptible to injury. Digestive enzymes in feces, urea in urine, and gastric tube drainage also contribute to skin exudation, area of loss of the superficial layer of the skin, also known as denodent area. These conditions can be caused by various factors including na yung muscle weakness or damaged nerve, certain medical conditions, or age-related changes. Fecal incontinence, result siya such as diarrhea, constipation, pelvic floor dysfunction, or Spencer muscle damage. Urinary incontinence can be caused by factors such as um, overactive bladder, weak pelvic floor muscle, urinary tract infection, or prostate problems in men. Next is decreased mental status. Individuals with a reduced level of awareness, for example, those who are unconscious, are heavily sedated, or have dementia, are the risk factor for pressure injuries because they're less able to recognize and respond to pain associated with prolonged pressure. Next is diminished sensation. Paralysis, stroke, or other neurologic disease may cause loss of sensation in the body area. Loss of sensation reduces an individual's ability to respond to trauma, to injuries, heat and cold, and to tingling pins and needles that signals loss of circulation. Dito sa diminished sensation, related ito siya sa patients na coma siya or di kaya strokes nang di sila masyadong makaramdam ng pain. Next is excessive body heat. An elevated body heat temperature increases the metabolic rate, thus increasing the cell's need for oxygen. This increased need is particularly severe in the cells of an area under pressure which are already oxygen deficient. Severe infection with accompanying elevated body temperatures may affect the body's ability to deal with the activity. Next is advanced age. The aging process brings about several changes in the skin and its supporting structures, making the older adult more prone to impaired skin integrity. These changes include the following. First is loss of lean body mass, generalized thinning of the epidermis, decreased strength and elasticity of the skin due to changes in the collagen fibers of the dermis. Next is increased dryness due to the decrease in the amount. Next is chronic medical conditions. Certain chronic conditions such as diabetes and cardiovascular disease are risk factors for skin breakdowns and delayed healing. This condition compromise oxygen delivery to tissue by poor perfusion and thus cause poor delayed healing and increased risk of pressure. So there are different stages of pressure injuries. First is the pressure injury light pigmented. Next is pressure injury, which is the stage 2. Stage 3 is the pressure injury. Number 3 is with next is the stage 4 pressure injury. Sa unstageable pressure injury, dark na siya sa deep tissue pressure injury. Next is the risk assessment tools. Although clients may be risk of developing a number of different alterations in skin integrity, the most common and most preventable are pressure injuries. Several risk assessment tools are available that provided the nurse with systematic means of identifying clients at high risk for pressure injury development. The tool chosen for use should include data collection in the areas of immobility, incontinence, nutrition, and level of consciousness. When assessing the pressure sites, first is ensure the lighting is good, preferably natural or fluorescent because incandescent lights can create transmitting effect. Regulate the environment before beginning the assessment so that the room is neither too hot nor too cold. Heat can cause the skin to flush, cold can cause the skin to blanch or become cyanotic. Inspect pressure areas for discoloration. This can be caused by impaired blood circulation to the area. The pressure arm should have wrist capability with the pass and finger thumb. Next is inspect pressure areas for abrasions and excoriations. Abrasions can occur when skin rubs against the sheet. Excoriations can occur when the skin has prolonged contact with the body secretion or excretion or with depression in skin folds. Palpate the surface temperature of the skin owner over the prasum areas. Warm your hands first. Normally, the temperature is the same as that the surrounding skin. Increased temperature is abnormal and may be due to inflammation. Palpate over bony prominences and dependent body areas for the presence of edema which feels spoggy and boggy.
Good morning, ma'am. My name is Kiasi Piadnes. We are the group 2, and today I'm going to report skin integrity wound care. Um, Wound healing. Healing is a quality of living tissue. It is also referred to as regeneration, renewal of tissue. Healing can be considered in terms of types of healing having to do with the primary care provider decisions on whether to allow the wound to heal itself or to purposefully close the wound, and phases of healing which refer to step and the body natural processes of tissue repair. So healing or tissue regenerations can be categorized by how the wound is managed, and the natural stage is goes through and repair. The decision to let the wound close on its own or to intervene is based on the provider judgments. Healing processes through phases in the body repair process, which are consistent for all wounds but vary in speed and completeness based on factors like wound type, size, locations, and individual health. So, example, nasugatan ako pero maliit lang siya. Kung ang sugat na maliit lamang, maaring hayaan lang ito sarili magsara or mag-heal ng kusa. Ngunit kung ang sugat ay malalim, kailangan talaga natin siya na ipunta na sa hospital para hindi ito para walang komplikasyon na mangyayari. Pero kung maliit lang man siya, magre-repair lang siya ng magre-repair siya lang. Pero depende din ito kung gaano kabilis na depende din ito kung gaano kabilis kasi hindi naman pareho ang sugat. May 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 malaki, may maliit, may malalim, may hindi. So depende. Kung maliit lang ang sugat mo na hindi malalim, hayaan mo na lang siya na mag-heal. Then types of wound healing. Primary intention healing occur when the tissue surfaces have been approximated close and there is minimal or no tissue loss. It is characterized by the formations of minimal granulations, tissue, and scar. It is also called primary onion or first intention healing. So primary intention healing, this type of healing, gina-involve niya yung minimal formations of granulous tissues and scar. It is also known as primary onion or first intention healing. A classic example is when surgical cut or stitch. Sa primary intention, pag na operahan ka or surgical, yun siya yung mga stitch. Ito yung um, then another example is using liquid glue called tissue or adhesive to seal clean cuts or decisions, often resulting in least noticeable scar. So, example, pag naghiwa ako ng gulay tapos na accident na sugatan ko yung sarili ko, um, so pag nasugatan ko ang sarili ko pero maliit lang naman siya at maliit, maaring kailangan mo lang na takpan ito ng bandage. Ito yung halimbawa ng primary intention healing. So, primary intention, dahil malapit ang mga sugat at may counting na, so dahil malapit yung sugat tapos may counting nawala na tissue sa paglipas ng panahon, gagaling yung sugat at maaring ay magkaroon ka ng maliit na peklat. Peklat lang. Then, secondary intention healing, a wound that extensive and involve considerable tissue loss and which the edge cannot or should not be approximate healed by secondary intention healing. An example of wound healing by secondary intentions is a pressure injury. Secondary intention healing differ from primary intention healing and ways. So then three ways. First is the repair time is longer. Number two is the scar is greater. Number three is susceptible and infections is greater. Then, sa secondary intention healing occur when a wound is left open to heal from the bottom up, filling in with new tissue gradually. So, ang example is a pressure injury, unlike primary intention healing, secondary intention healing takes longer, lead to more scar, and has higher risk of infections. Phases of wound healing. Wound healing can be broken down into two phases: inflammatory phase, proliferative phase, alterations or remodeling phase. Inflammatory phase begin immediately after injury and last 3 to 6 days. Two major processes occur during this phase. So first is homeostasis, the cessations of bleeding result from vaso vas vasoconstrictions of the larger blood vessel and affected area restrictions, drawing back of injured blood vessels. So, ang homeostasis ay ito yung siyang ginapatigil na yung dugo. Halimbawa, nasugatan ka, then, ayun na, di ba, nasugatan ka, tapos nagdugo siya, then, lalabas, then, magpapakita na si homeostasis para pigilan yung pagdurugo. Kaya, Kaya kung may bleeding tayo, 'di ba, nasugatan tayo tapos maya-maya kuan hihinto din siya because of homeostasis. So ang vasoconstrictions at vessel restriction ay nagtutulong upang bawasan ang pagkalugi ng dugo mula sa lugar na nasugatan, na sa huli ay nagreresulta ng homeostasis. So, yun na yun. Kaya nagreresulta siya ng homeostasis. So, may halimbawa ako. Um, homeostasis Halimbawa ng homeostasis ay pagtigil ng pagdurugo, 'di ba? Yun na yun, pagtigil ng pagdurugo kapag may sugat ka sa balat, kapag naputol mo ang iyong daliri at nagsisimulang dumugo, nakikita mo ang unang nagkakaroon ng pagpi, pagpipino pagpipino sa paligid ng sugat upang pigilan ang pagtakas ng dugo. Tapos, ang mga nasugatan na ugat mismo ay nagre-react o kumukubra pabalik sa loob ng katawan upang bawasan ang pagbukas nito. Sa kabuuan ng mga ito ay nagtutulungan upang itigil ang pagdurugo at magdulot ng homeostasis. So, fibrin, a connective tissue, and the formations of blood clot in the area. The blood clot provide a matrix of fibrin that becomes the framework for cell repair. A scab may also form on the surface of the wound, consisting of clots and dead and dying tissue. This scab serves to aid homeostasis and inhibit contaminations of the wound by microorganisms. So, ang fibrin ay isang uri ng connective tissue na may mahalagang papel sa pagtigil ng pagdurugo o homeostasis siya. Kapag may nasugatan na ugat na dugo, ang fibrinogen, isang protina ng dugo, ay nagiging fibrin stance. Sa pamamagitan ng isang serye ng mga reactions, enzymations, and mga fibrin strands na ito ay bumubuo ng isang tulad na rehas na estruktura na humuhuli ng mga selula ng dugo at platelets na nagdudulot ng pagkabuo ng mga blood clot sa lugar na pinsala. Ang mga blood clot ay nagbibigay ng isang estruktura na or mga gawa sa fibrin para sa pagkukumuni ng selula. Ang fibrin matrix na ito ay naglilingkod bilang pundasyon. So, pundasyon siya kung saan maaring lumago ang bagong tissue at mapalitan ng para mapalitan yung nasira na tissue. Then, next, next is um, proliferative space. The proliferative space, the second phase in healing, extended from 3 day 3 or 4 to about day 21 post-injury. Fibroblasts, connective tissue cells, which migrate into the wound starting about 24 hours after injury, begin to synthesize collagen. Um, okay. So, dito naman sa proliferative phases, during the proliferative phase, which is the second phase of healing process, fibroblasts play a crucial role in the tissue repair. Fibroblasts are a type of connective tissue cell responsible for producing collagen, which is main structure protein in the body connective tissue. So, around 24 hours after the injury occur, fibroblasts start to migrate into the wound site. Once they arrive, they begin synthesize collagen. Collagen serve as framework or scaffold for inflammations and new tissue, providing strength and structure to the healing wound. So, as collagen productions continue, the wound gradually becomes stronger and more organized. This phase typically extends for 3 or 4 after the injury, continue until day 21 post-injury. So, ang example niya, proliferative phase sa paggaling ng sugat ay kapag nasugatan ka ng malalim sa iyong braso pagkatapos ng isang araw ng pagsisimula ng pagsasara ng sugat at pamamaga, nagsisimula ang proliferative phases. Ang mga fibrous, mga espesyalisadong selula na matatapuan ng connective tissue ay nagsisimula mag-migrate papasok sa lugar ng sugat mga 24 hours matapos ang pinsala. Kapag dumating sila, nagsisimula na mag-produce ng collagen. Ang pangunahing protina na responsible sa pagbibigay ng lakas at estruktura sa mga tissue. Sa sa loob ng isang linggo, patuloy na pag-produce ng mga fibrous blast ng collagen unti-unti itong pinupuno ang sugat sa bagong tissue bilang resulta ng naglalapit ang mga gilid ng sugat, lumalakas ang sugat. Then isipin mo um, na sinusubaybayan mo ang sugat sa paglipas ng mga panahon. Sa simula na maaring mangitim at magkaroon ng pamamaga, ngunit habang tumatagal ang proliferative phases, mapapansin mo unti-unti itong naglilipat at bumabawas ang pamamaga. Sa huli, ito ay nagiging isang peklat na pag, um, nagpapahiwatig na pagtatapos ng proseso ng pagaling. Ang piklat na ito ay pangunahing binubuo ng fiber or collagen na ginawang proliferative pieces. Um, like, like ganito, 'di ba kung nasugatan tayo tapos grab yung parang yung dugo na something basta yun, hindi ko ma-explain. Then, collagen is a whitish protein substance that adds tensile strength to the wounds. As the amount of collagen increases, so does the strength of wound. Thus, the change that the wound will remain closed progressively increases. So collagen is a protein that kind of whitish and it's make the wound stronger. The more collagen there is, the softer the wound gets, which means it's more likely to stay closed. If you have stitches, you might notice a little bump called healing ridge where the stitches are. If you don't have stitches, you can sometimes see the new collagen forming into the wound. So, example, nasugatan ka sa iyong daliri habang nagluluto. Sa mga sumusunod na araw naman, nagsimulang gumaling nagsisimulang gumaling at magsara. Ang prosesong ito ay magpapasara at tinutulungan ng collagen ang isang protina ng isang katawan, nagpapalakas ng mga tissue. Sa pamamagitan ng sugat, mas maaaring collagen ay ginagawa ng nagdaragdag ng lakas sa lugar. Sa bandang huli ng sugat ay nagiging hindi gaanong halata at maaari mong makita ang isang maliit na bukol sa tahi at tinatawag na healing range. Ang bukol na ito ay nagpapakita ng sugat ay maganda ng nagsasara at lumalakas. Kahit wala kang tahi, minsan ay nakikita mo pa rin na bagong collagen na bumubuo sa sugat, lalo na kapag ay nagsisimula na mag-scarp at naghilo. So, kagaya nung sinabi ko kanina sa prolactive base, gano'n. Nandun yun siya kanina. Then, granulations tissue are fragile and bleed easily when the skin edge of wound are not sutured. The area must be filled in which granulations tissue. When the granulation tissue matured, marginal epithelial cells migrate to its proliferating over this connective tissue base to fill the wounds. Um, So granulations tissue, while important for wound healing, is fragile and tend to bleed easily when the wound is not stitches, called the gaps must be filled in with granulations tissues. As granulations tissue mature, epithelial cells from wound's edge migrate onto it, multiplying to cover the tissue based on the field wounds. If the wound is closed through this process called epithelializations, it may become covered with dry plasma proteins and dead cells. So, example, may sugat ka sa tuhod dahil sa pagbagsak mula sa isang bisikleta. Kung ang sugat ay maaaring hindi tinahi, ang mga gilid, ang balat, nagkakaroon ng granulation tissue sa loob ng sugat. Upang tulungan ito paghilom, ang granulation tissue ay parang siyang rosas like this. Malambot siya at madaling masugatan ang tissue sa pumupuno sa puwang kung saan nawawala ang balat. Like this, nawawalan siya ng balat. Sa paglipas ng panahon, habang naghihilom ang sugat, nagsisimulang kumilos ang epithelial cells mula mula sa gilid ng sugat patungo sa granulations tissue. Ang mga silulang ito ay dumadami at kumakalat. Unti-unti nilang tinatakpan ang batayan ng tissue at sinasara ang sugat. Ngunit kung ang anumang dahilan tulad ng infeksyon or hindi maayos na pangangalaga sa sugat hindi nagsasara ng maayos ang sugat, maaaring matakpan ito ng tuyong dugo at patay na selula na maaaring magpahaba ng proseso ng paghilom at dagdagan ang panganib ng infeksyon. Next is a scar. Initially, wounds healing by secondary intensity, blood, tanged, serogenous, drainage, later, if they are not covered by epithelial cell, they become covered with thick gray fibrinous tissues that is eventually converted into dense scar tissue. So, um, the example is sa simula ng pagsugat ng paghilom, pamamagitan ng secondary intentions, ay nagdudulot ito paglubog ng dugo. Like this. Yung maglubog yung dugo mo sa mas halong kulay or serogenous sa discharge sa sumusunod na araw kung hindi natakpan. Reset man eh. Infections, contaminations of a wound surface with a microorganism colonizations is an inevitable result because the surface cannot be protected from contact with unsterile objects. So, infection occur when organisms such as bacteria, viruses, or fungi invade a wound's surface and multiple causing harm to the body tissues. Contamination, which is introduced of this microorganism onto the wound surface and often inevitable because it's challenging to keep the wound completely sterile, especially in everyday environment where contact with an unsterile object is commonly. Once microorganisms colonize the wound surface, they start competing with new cells for essential resources like oxygen and nutrition. These competitions can hinder the wound's healing processes by depriving the new cell of the vital elements they need to grow and repair the damaged tissue. Moreover, the product produced by these colonizing microorganisms can further disrupt the healing processes. For instance, some bacteria release toxin can damage surrounding tissues and depends the formations of healthy new cells. Other may create an environment that is conducive to their own growth but detrimental to the healing process. So overall, this presence of contaminations on the wound surface can impair wound healing and increase the risk of infections, prolonging recovery time and potentially leading to more severe complications if left untreated. Therefore, minimizing contaminations and properly addressing any sign of infections are crucial step in promoting successful wound healing and preventing further complications. Example, isipin mo na may taong naaksidente at nasugatan na malalim sa kanyang binti habang nas, nas, nasa gubat kahit na sinisikap niyang linisin ang sugat gamit ang isang antiseptic wipe mula sa kanyang first aid kit. Mahirap talaga na lubos na patayuin ang lugar dahil sa paligid na kalikasan, may dumi, labi na halaman at iba't ibang microorganism na naroon sa kapaligiran at maaaring itong makadikit sa sugat. Bilang resulta, naging contaminated ang sugat ng bakterya mula sa paligid ng kapaligiran. Nagsisimula ang mga bakterya na maparami at ibabaw ng sugat, bumubuo ang isang kolonya. Habang lumalaki sila, kinakain nila ang oxygen at sustansya na dapat sana ay magagamit ng mga selula ng katawan na responsable sa paghilom ng sugat. Bukod pa dito, ilan ng mga bakterya na ito ay nagproprodukto ng mga toxin bilang product ng kanilang metabolism. Ang mga toxin na ito ay maaaring magdulot ng pinsala sa mga paligid na tissue at lumikha ng isang kapaligiran na hindi masyadong favorable sa paghilom. Sa halip ay natakbuhin ng paglago ng malusog na mga bagong selula, ang pagkakaroon ng toxin na ito ay maaaring hadlang ang proseso ng paghilom at dagdagan ang panganib ng impeksyon. So kung hindi maayos na alagaan ng bantayan ng sugat, ang mga bacteria contaminations ay maaaring magpatuloy hanggang sa maging impeksyon na kinikilala sa pamamagitan ng pamumula, pamamaga, init at pagtaas ng sakit sa lugar ng sugat. Kung hindi ito agad ginamot tulad ng gamot na antibiotic at tamang pangangalaga ng sugat, ang impeksyon ay maaaring lumala na maaaring magdulot ng mga seryosong komplikasyon tulad ng pinsala sa tissue, sistematikong impeksyon o kahit sepsis. So dehensive with possible adves- adversariations. So dehensin is a partial or total rupture of such war wounds. The hensim usually involve an abdominal wounds in which the layer below the skin also separates. So the the hensin is when the wounds that has been stitches have particular or completely open up again. It's often happen when the wound is the abdomen, when the layer beneath the skin come apart. This can sometimes lead to the inside of the body pushing through open, which is called eviscerations. So, ang dehensive daw, ito yung na-open na, na-operahan, na-open siya. Then, ang example, pag may sugat ka na tinhit, tapos bumukas ulit, yun, yun ang tinatawag na dehensive. Kapag naghiwalay ang mga layer sa ilalim ng balat at na, nakapasok ang mga internal organs sa butas, yun naman ang eviscerations. Okay. Then, halimbawa, kung mayroon kang operation sa tiyan at bumukas ang sugat mo at pumasok ang iyong bituka sa butas, yun ang tinatawag na dehensive na may possible eviscerations. Tapos, sa evisceration naman is a protrusions of internal organ to excisions a number of factors including obesity, poor nutrition, multiple trauma, failure of suturing, excesses, sieve, coughing, vomiting, and dehydrations, heighten a client risk of wounds. Dehensin. Wound dehensive is more likely to occur 4 to 5 days postoperatively before extensive collagen is deposited in the wounds. The eviscerations is when your inside-like organ push out through a cut on your body. It can happen for various reasons, like being overweight, not eating well, having multiple injury, or the wounds not being stitches properly. Things like coughing a lot, throwing up, or being really dehydrated can also increase the risk. Um, Dehency, which is when wound reopen, is more likely to happen around 4 to 5 days after surgery before the body has had enough time to build up strong tissue to hold the wound together. Example, imagine you have a cut on your stomach from surgery. If you're not taking care of yourself, maybe you're not eating right or you're overweight, that cut might not heal properly. Then if you start coughing a lot or throwing up, it's called push your inside out through the cut, which is eviscerations. And if the wounds reopen, that's called dehensive. It's like stitching did hold the cuts closed well enough. Then factors affecting wound healing, developmental considerations, nutrition, medications, and lifestyle. So, factor affecting wound healing first is developmental considerations. Healthy children and adults often heal more quickly than older adults who are more likely to have chronic disease that higher healing. For example, reducing liver functions can repair and synthesize blood clotting factors. Um, when people get hurt, like when they have a cut or a bruise, their body works to fix it. Young, healthy people usually get better faster than older people. who might have other health problems. Older people might have issues like diabetes or problem that make it harder for their bodies to heal quickly. One example is that when the liver doesn't work well, it can make it tough for the blood to clot, which is important to stop bleeding in healing wounds. So basically, age and healthy can affect how, how quickly someone heal when they gets old. So, talagang totoo naman na mas madaling mag-heal yung mga bata because they are more healthier in hindi sila prone sa mga bacteria and sakit. Not unlike sa mga matatanda na, talagang prone talaga sila. Then nutritions, wound healing places additional demands on the body. Clients require a diet rich in protein, carbohydrate, lipids, vitamin A and C, and minerals such as iron, zinc, and copper. Malnourished clients may require time to improve their nutritional status before surgery if this is possible. Um, so to help wound heal, The, the body need extra nutritions. Clients should eat food high in protein, carbs, fats, and vitamins like A and Z, along with minerals like iron and zinc and copper. If someone is not getting enough to these nutritions, they might need to eat better before surgery, if that's an option. Being overweight can make healing slower and increase the risk of infections because fat tissues don't have as many blood vessels to bring nutrition to the wounds. So it's important for people to eat well to give their bodies the need to heal properly. So example, pag ako nasaktan yung binti ko at kailangan ko ng operation para ayusin ito. Bago ang operation, sinabihan ako ng doktor na dapat kumain ako ng marami na pagkain tulad ng manok, isda, prutas at gulay dahil may mga sustansyang kailangan ang aking katawan para bumulis ang paghilom. Dapat din daw na iwasan ko ang pagkain ng masyadong maraming junk foods dahil hindi ito nakakatulong sa aking katawan. So, yun siya. So, we need a nutritions. Then, third is lifestyle. Clients who exercise regularly tend to have good circulations, and because blood being oxygen and nourishment to the wounds, they are likely to heal quickly. Smoking reduces the amount of functioning hemoglobin in the body, thus limiting the oxygen carrying capacity of the blood and constrict anterioris. In people daily lives, regular exercise help maintain good blood circulations throughout the body. When blood flows well, if its efficiency deliver oxygen and nutrient to wounds which promote faster healing. It's reduce the amount of functional hemoglobin in the blood, sorry, which lead the decreased ability for the blood to carry oxygen. Additionally, pag nag-smoke ka, nag-constrict siya sa anterioles which hinder blood flow. Therefore, regulating exercise is crucial for speedy recovery, while smoking can be adverse effective in wound healing process. So may example ako. May dalawang magkaibigan, si Emily and si Mikey. Who both good both sila na injured while playing the sports. So, Emily is a regular at the gym and enjoy jogging every morning because her active lifestyle her blood circulation is excellent. When she gets a cut while hiking, her body quickly sends oxygen and nutrients to the wounds, and it's healed up in no time. On the other hand, Mike is a smoker and do not exercise much. When he sprained his ankle during the game, his body struggled to deliver enough oxygen to the injured areas. Due to the harmful effects of smoking on his blood circulations, as a result, his injury took longer to heal and he experienced more discomfort. For example, illustrate how lifestyle, illustrate niya ito how lifestyle choice like exercise and smoking. So paano ito na paano ito na effect or anong impact ito sa body ability to heal from injury. Then medications, anti-inflammatory drug, example steroid and aspirin, and anti-neoplastic agents interfere with healing. Prolonged use of antibiotics may make a client susceptible to wounds infections by resistant organisms. So um, some medications like steroid and aspirin, as well as certain cancer drugs, can slow down healing. When you take this medicine, they might interfere with your body ability to heal cuts or wound properly. Also, if you use antibiotics for a long time, it can make it easier for your body to get infections from bacteria that are resistant to those antibiotics. Some, while medicines can help in many ways, they can also affect how quickly you heal and make you more prone to infections. Example, ako nasaktan sa tuhod habang naglalaro. Pumunta ako sa doktor at binigyan niya ako ng gamot para sa sakit ng pamamaga. Ngunit, pero, na ang gamot na ito ay naglalaman ng steroid na maaaring magpabagal ng proseso ng paghilom ng katawan. Bilang resulta, mas matagal gumaling ang tuhod ko kumpara kung hindi siya uminom ng gamot. So, yun siya. Yun yung explanations about medications na ginatake natin na may steroid. Next is assessing the skin integrity. The nurse conduct an examinations of the integument as part of routine assessment and during regular care, removing barrier to assessment, and very important, anti embolic stocking, brace, or device must be removed to assess the skin conditions and underneath. So ang explanation ko dito is when the nurse check your skin, they're making sure it's healthy. And does have any problem to do this, they need to see your skin clearly. Sometimes you might be wearing things like stocking or brace that cover your skin. This thing need to be taken off so the nurse can check your skin properly. It's like taking off your gloves to see your hands better. This way, the nurse can make sure your skin is okay and give you the right care if needed. Kung may nakikita siya pa sa skin integrity mo, then yun. Then assessing the wounds, so assessment of the wounds, nurses commonly assess both untreated and treated wound. So when the nurse check your skin, they're making sure you're healthy. And to do this, they need To see your skin clearly, sometimes you might be wearing things. So, so dito naman sa assessing the wounds, nurses commonly assess both untreated and treated wound. Then, then untreated wounds. Untreated wounds usually are seen shortly after an injury, example, at the scene of the accident or an emergency center. So untreated wound can indeed be quite noticeable shortly after an injury occur, whether it's a cut, a burn, or any other form of trauma to the skin. The body naturally responds kicks and to start the healing process. However, without proper care and treatment, this wound can become more severe and prone to infections. It's essential to clean and dress wounds properly to prevent complications and promote proper healing. So, example, imagine someone accidentally cuts their hands, not seem severe but it's still bleeding and visible open. Without proper treatment such as cleaning the wounds with soap and water, applying an antiseptic and cover it with a bandage, the wound remain exposed to bacteria and other contaminants over time. Without treatment, and wound might become infected and leading to complications such as inflammation, pain, and potentially even spreading infections to the other parts of the body. Treated wounds are suture wounds are usually assessed to determine the progress of healing. These wounds may be inspected during changing of dressing. So a treating wound has been cleaned, disinfected, and possible dressed with bandage or other appropriate materials. Medical treatment may also involve the use of antibiotics or other medications to prevent infections, promote healing, and alleviate pain. Additionally, depending on the severity of the nature of the wounds, medication professional may perform procedures such as suturing, stitching to close the wounds and facilitate proper healing. Then, so ang pagkaibahan lang nila sa untreated wound and treated wound, um, untreated wound lack lack siya medications and attentions and nag-risk of complications, while treated wound receive appropriate care for promote healing and prevent further injuries. Then, if you leave the cuts untreated, you might just rinse off with water and let it dry. This means you are not applying any disinfectant or covering it with bandage without proper care. The wound could become infected and leading to be swelling and possible even more serious complications. Then, conversely, if you treat the wounds, you would clean it with soap and water, remove any dirt or debris, then you might apply antiseptic like hydrogens, peroxides, or rubbing alcohol to kill the bacteria. Finally, you cover the cuts and sterile bandage, step and clean protect from further injury. So, sa untreated wound, walang ginagamit yung wala talaga yung hindi talaga na gina-treat, parang wala siyang mga medical na ginagamit, yung attention, like medical attention na ginagamit, like yung bandage, wala siyang ganun. Yung inahayaan na lang siya, ginarin sa water, tas mag-dry, yun na lang siya. Then sa treated wound naman, ginagamitin siya ng mga medical needs, like yung mga alcohol and bandage, like that. So, ang pagkaiba na nila, ang untreated walang ginagamit, hinahayaan lang. Then, untreated one, ginagamitan ng mga alcohol, like any ay, as, aseptic na mga gamit. Yun siya. Then, next is, ito naman, sa parallel swab to measure the wound depth. So, dito naman sa parallel swab used to measure wound depth, ito naman ay, ito yung pag-measure ng yung mga sugat natin kung gaano ba ito siya kalalim. Yan siya. Ito yung ginagamit para masukat kung gaano kalalim, gaano kalaki yung wound natin. So, yun lang po. Thank you. Yun lang po.